Hi, my name is Dr. Wes, and today we're going to discuss Alagille syndrome and neuronal linkage. Before we start our discussion on this syndrome, it's very important to know two genes, that is the JAG1 and NOS2. JAG1 mutation causes much of the syndrome, while the NOS2 is the receptor site uh, for JAG1 gene. It causes disruption uh, in the development of liver, bile duct, heart, blood vessels, kidneys, skeleton, eye, and nervous system. The objective of this discussion is the genetic basis, mechanism of neuronal linkage, and diagnostic work and prognosis. That is the overview, usually caused by JAK1, less commonly NOS2. Uh, Primary developmental defect of abnormal NOS2 signaling, core hepatic lesion, paucity of the intrahepatic bile duct, major extrahepatic involvements, heart, kidney, skeleton, eye, and blood vessels. The mechanism, JAG1 NOS2 mutation, abnormal NOS2 signaling, impaired bile duct development, bile duct paucity, uh, cholestasis, and bile acid retention, pruritus, fat-soluble vitamin deficiency, poor growth, systemic and neuronal consequences. That is the mechanism of this disease. That is the mechanism of neuronal linkage, neurodevelopment pathways, vascular pathways, pruritus pathway, vitamin deficiencies, especially vitamin A, D, E, K deficiency, sleep and cognition pathways get disrupted during this phase, especially patient with these kind of syndrome having chronic pruritus illness disturbs sleep, concentration, mood, and school performance. Diagnosis, clinical finding, jaundice, pruritus, growth failure, and characteristics, facies, laboratory test, LFTs, bilirubin, GGT, bile acids, fat-soluble vitamins. System screening include echocardiography, eye monitoring, spine X-ray, renal ultrasounds. Liver biopsy show bile duct paucity. Genetic testing for JAG1, JAG2 should be there for these diagnostic workup. Treatment is very important. Improve cholestasis uh, and liver biochemistry. Control pruritus, cholestyramine, rifampicin, bile duct transporter inhibitors such as Meral exhibit uh, when appropriate uh, gut nutrition for these kind of patients and treat associated organ diseases like cardiac disease and renal monitoring should be there. Prognosis, better outcome, mild cholestasis, good nutrition and growth, no major vascular or cardiac complication, early development support. Poor prognostic factors included severe pruritus and poor growth, complex congenital heart disease, intracranial vascular abnormalities, delay diagnosis, and limited access to care. And long-term work needs multidisciplinary follow-up, uh, neurodevelopmental surveillance, school and rehabilitation support, transition planning to adolescence and adulthood. Summary: JAG1 NOS2 related development disorder caused by abnormal NOS signaling, the core hepatic lesion of the bile duct, uh, to cholestasis, pruritus, vitamin deficiency, and growth factors. Neuronal linkage should be monitored, uh, especially if it is related to vitamin deficiency, especially vitamin A, D, K, and vitamin E. Sleep disturbance. Diagnosis combines clinical findings with laboratory tests, echocardiography, eye skeletal assessment, and renal evaluation. Management and multidisciplinary. Thanks and regards. Please like and subscribe this channel for further discussion on different diseases, important rare diseases. Thanks.